Over the years, and I have been in practice for almost like 20 years, I have been noticing a correlation between diabetes and higher grades of baldness. The correlation was so strong in my observations that I decided to embark upon a research. And what did I find? I found that significant research has already been done in this field, and there is established correlation between uncontrolled diabetes and androgenic alopecia grade 3 and above. Now in this video we're going to talk about insulin resistance and diabetes and what is their connect with the prevalence or incidence of higher grades of baldness. So insulin resistance is a sneaky cousin of diabetes which causes utter chaos in your blood sugar levels, thereby wreaking havoc on your hair follicles. Many would be astounded when I reveal the fact that early appearance of thinning and a distinct pattern of higher grades of baldness is a harbinger of bad news. Bad news not only for the way you look, but bad news also for your health and longevity. It is actually a huge shame how patients self-diagnose, self-medicate, thinking that what they are suffering is plain and simple androgenic alopecia. They do not realize that androgenic alopecia, besides being genetic in nature, is controlled by a host of other factors which are called epigenetic factors and which I have covered in a previous video. Besides these factors, nature is trying to tell you something. It is trying to warn you about certain health conditions, and that is the topic of today. So insulin resistance, a symptom associated with diabetes, is known to cause hair loss. In addition to losing more hair in diabetes, the presence of diabetes can significantly slow down the rate of growth of hair. So researchers have noted that early onset of androgenic alopecia is a marker of insulin resistance, a marker of type 2 diabetes. Recently, I stumbled upon a study by Bhatti et al. In which he described 100 males suffering from AGA, and he suggested that patients with higher grades of baldness above grade 3 should be routinely assessed for insulin resistance, should be routinely assessed for diabetes. And more recently, a systematic review, a conglomeration of 31 studies in which 50,956 individuals were made a part of the study, of which 29,254 patients were suffering from androgenic alopecia. This study revealed that those patients who had androgenic alopecia had a higher risk of suffering from dyslipidemia, insulin resistance, diabetes, hypertension, and heart disease. Now, what is insulin? Insulin is a peptide hormone synthesized and secreted by the beta cells of the pancreas, and glucose is the main regulator of insulin secretion. As the glucose concentration in the body increases, the body stimulates insulin secretion. Some of the glucoregulatory effects of insulin are glycogenolysis, gluconeogenesis, increased transportation of glucose into the adipose tissue, into the muscles, stimulation of glycogen synthesis, as well as playing a major role in lipid and protein metabolism. And now we go on to insulin resistance. What is insulin resistance? Insulin resistance merely means that the body produces more insulin, but the body does not use it effectively. Does not use it effectively because of the reduced responsiveness of target cells or organs. And this is a well-known key pathological factor for type 2 diabetes mellitus. And this presents many years before the diagnosis of diabetes in that individual is made. Insulin resistance has been thought to be due to excess accumulation of adipose tissue or fat cells, which has biochemical effects due to the secretion of multiple cytokines, and which clinically translates into what is called as the metabolic syndrome. It is important to acknowledge here that every patient with diabetes, before the diagnosis of diabetes is made, type 2 diabetes mellitus, would have had insulin resistance for many years preceding the diagnosis. Now, what does insulin resistance do? Insulin resistance exerts a pathogenetic role in the miniaturization of follicles. Vasoactive substances associated with endothelial dysfunction in insulin resistance leads to microcirculatory imbalance, perifollicular vasoconstriction, and proliferation of smooth muscle cells in the vascular wall. Now, this condition leads to microvascular insufficiency, local tissue hypoxia, and progressive miniaturization of hair follicles. Hyperinsulinemia plays a role in local androgen production, whether de novo from cholesterol or by locally converting testosterone into DHT. This DHT inhibits adenyl cyclase activity and is able to curtail the anagen cycle and is most likely responsible for miniaturization of follicles in androgenic alopecia. In addition, insulin resistance leads to the generation of inflammatory mediators and endothelial dysfunction. Insulin increases the release of nitric oxide at the endothelial level from the endothelium in physiological levels. An increased risk of atherosclerosis or presence of plaques in vessels in those with insulin resistance is thought to be related to the loss of insulin's effects on nitric oxide expression. Is there a way to diagnose insulin resistance? Yes, there are ways to diagnose insulin resistance, but they are pretty prohibitive, very expensive tests. The gold standard test for insulin resistance is the euglycemic insulin clamp. It is a complex, invasive, prohibitively costly test, and therefore an unfeasible test to implement in clinical practice. However, the body gives you a clue to insulin resistance. It has been noted that there is increased incidence of certain skin conditions, skin manifestations of insulin resistance like acrocodons, acanthosis nigricans, acne, hirsutism, and of course, androgenic alopecia. Now, these skin manifestations offer a reliable, straightforward, and real-time way to detect insulin resistance. Can insulin resistance be reversed? Yes, if you detect insulin resistance, you can reverse it through medication, but most importantly, through lifestyle changes. Reduce your fat content, reduce your BMI, but reduce weight gradually. Do not crash diet. A minimum initial prolonged fast of 36 hours to 3 days may be needed to start the process of reversing insulin resistance. So that is the talk for today. The established correlation between insulin resistance and higher grades of baldness. The appearance of higher grades of baldness at an early age may be a red flag sign that you need to take care of your health. So thank you for watching again. If you have any questions about this talk, about hair loss, hair transplant, or any other question arising in your mind, do let me know and I'll be there to help you. I'll respond within 2 days. For those who haven't subscribed yet, please do. Your engagement keeps the channel going. Thank you for watching again and God bless you.